So I'm Tedjo Sasmono from the Eijkman Institute, and I would like to share my talk on dengue and COVID diagnostic cross reactivities, and I will be highlighting some preliminary data from Indonesia. So I think Martin already explained very well on the dengue, and so just a little bit introduction of dengue in Indonesia. So according to WHO, dengue is one of the most important mosquito-borne diseases in the world, and Indonesia is actually the country which reports the highest number of dengue in Asia, and the second in the world after Brazil. And also the global dengue risk map classified Indonesia as a country with frequent or continuous risk for international travelers. And of course, dengue is a health problem in Indonesia with year-round transmission. And prevention depends on the factor control and community participation, and hopefully we will have a good vaccine in the coming years. And well, when it is in a hospital, then early diagnosis is important for better patient management. So dengue cases in Indonesia firstly reported in 1968, so it's already 5 decades now. And the incident rate is drastically increased from 0.05 in 1968 to 86 per 100,000 population in 2016. However, the case fatality rate is decreased over time. So, but we also have periodic outbreaks within 6 to 8 years, periodic outbreak of dengue. And what about dengue during the COVID pandemic in Indonesia? So as of yesterday, there are 2,078,000 COVID-19 patients reported in Indonesia, while according to the Ministry of Health, in this September, there are 84,000 dengue cases reported in Indonesia. So basically, dengue patients keep coming to the hospitals during this COVID-19 pandemics. And in a few months now, Indonesia will be starting wet season, and I think there will be more dengue patient coming, while the COVID-19 pandemic is still ongoing. So it will be add more burden to the hospitals and the clinician handling both diseases. So Prof. David already mentioned about the similarities of dengue and COVID. So this is just a brief overview again. So although each disease has their own specific characteristics on a clinical characteristics, like this one, COVID-19 has a characteristic of cough and sore throat and difficulty in breath and nasal congestion, while dengue has also characteristics, unique symptoms like rash, joint pain, retroorbital pain, abdominal pain, bone pain, and bleeding. But those diseases share similarities as well. So especially this one is the fever, the malaise, myalgia, headache, diarrhea. And then for the laboratory finding, Prof. David also already mentioned about the thrombocytopenia and the leukopenia and transaminitis. So this similarity in a disease manifestation can lead to the misdiagnosis in the hospital. So this is why we need to aware of it. So I'll talk about this in the next slide. So this is a example of the false positive dengue serology among COVID-19 patient reported by Gabriel Yan in Singapore. So this is just an example how a patient with the COVID-19 come to the hospital, and then with the thrombocytopenia, fever, but the first one was negative for NS1, IgG, and IgM dengue. And then it's went home and then back to the clinic with the fever again, and then was tested positive for dengue, IgG, and IgM. And based on this, he was hospitalized for dengue, although with cough and dyspnea. But then in hospital, when tested with the RT-PCR, the COVID-19 is positive. So and then repeat of the dengue rapid test was negative. So it is deemed that the first test was a false positive. Similar patient, fever, myalgia, this is like dengue, and then diarrhea, and then it's tested positive for dengue IgM. While the X-ray was normal, and then it's remained febrile, and then tested using the RT-PCR when positive. So we can see here that the initial dengue IgM result is actually a false positive. So this is quite disingenuous in terms of patient management. So what about dengue and COVID-19 diagnosis in Indonesia? So for dengue, in addition to the clinical diagnosis, most hospitals and health centers in Indonesia are increasingly using the dengue NS1 antigen detection, and also IgG and IgM RTT, rapid diagnostic test, because this RTT is quite easy to use. It's simple and then also cheap. While for COVID-19, RTT, well, it's not used as diagnostic tool. Yeah, the WHO is not recommending this RTT for diagnostic of COVID, and also Indonesian Ministry of Health is not recommending as well. But they're still being used for a specific usage, like screening of COVID-19 in specific population. Like in Indonesia, when you are traveling, then you need to have an RTT results before you can come to the airport and to the train station. This is it's common in Indonesia, and also in a specific condition in Indonesia. For example, in a remote hospital, remote health center where the RT-PCR is not readily available. So with this, there is a possibility of cross-reactivity between dengue virus and SARS-CoV-2, which could lead to false positive result and misdiagnosis for both diseases. And of course, we need to continuously update the information on the specificity and possible cross-reactivity of both dengue and COVID-19 RTTs. So this is the focus of my talk here today. I think Joseph also mentioned about the IgG and AGM RTT. So basically, this test is immunochromatography assay using a lateral flow. It detects the presence of or absence of IgG and AGM antibodies in the blood, both for dengue and COVID-19. And this is the rapid test that usually commonly used in the hospitals in the community. And I think also Martin and Joseph also explained this one as well. The AGM detection for dengue, it's in the early 5 or 7 days of the infection. And I think the similar kinetics as well for COVID-19, although it's still the knowledge is still always developing for the COVID-19 antibody kinetics. So to assess the performance of RTT, we should look at the sensitivity and the specificity of the RTTs. The sensitivity is the ability of a test to correctly identify those with disease. So it's the true positive rates, while the specificity is the ability of a test to correctly identify those without the disease, so true negative rates. So in the context of dengue and COVID-19, so what we are looking at is the specificity, because they put a different diseases. So for dengue RTT, the specificity, the specific dengue RTT should be negative for COVID patient, and in the vice versa, the COVID-19 RTT should be negative on dengue patient. So this is the example of the publication on the assessing the performance of COVID-19 antibody RTTs. There are many publications now. Initially, there's only a few limited data, and now it's accumulating the publication. This is just an example. And if we look at the specificity here, basically the specificity of the COVID-19 IgG and AGM is quite high. It's above 90%. And this is this is another example. So evaluating 7 different COVID-19 RTTs, IgG and AGM, was done in Belgium. And if you look at the sensitivity, well, I'm not talking a lot of about the sensitivity, but the specificity, because we are talking on the context of dengue and COVID. So the specificity is also quite high for IgM, 90%, 90 for IgG, and 85% in the combination of IgG and for IgM. And this is also a quite important data from the meta-analysis of the COVID-19 rapid test. The sensitivity, if you look at the overall here, it's around 61%, 64% for IgG and IgM. And the specificity, again, is quite high. And as expected, the sensitivity is increasing because it's detecting the antibodies. So increasing with the time, like this one here. So many COVID-19 RDT are available in Indonesia. You can buy it via online shop even, and in hospital is also provided with this many COVID-19. However, although there are data on the sensitivity and specificity of this rapid test, but still limited data available for dengue, specifically for dengue, and for data from Indonesia. And similarly, there are a lot of dengue RDT available in Indonesia. So there are dozens of RDT. Dengue is a little bit better now, they have already the specificity data, and it's quite because it's already quite established, but not COVID-19. So to assess the possibility of cross-reaction on the RDT diagnosis of both diseases, so we've done a small study looking at the COVID and dengue RDT, IgG and IgM antibodies. So basically, to look at those possibility of cross-reaction, possibility of false positive, we have done a small study. The first strategy is to look at the dengue confirmed samples on COVID-19 RDTs. So this is a dengue samples, dengue patient on COVID-19 RDTs. And then the second one is the COVID-19 serology positive samples. So this is samples with the IgG and IgM positive COVID-19 tested on the dengue RDT. And then the third one is the serum from COVID-19 PCR positive. This is the confirmed positive samples, again tested on dengue RDTs. So the first one is it's looking at the dengue confirmed samples tested on the COVID-19 RDTs. So the aim is to evaluate the specificity of the COVID-19 RDTs available in Indonesia against dengue confirmed samples. So the RDT for COVID tested on dengue samples. So we have chosen 60 RT-PCR confirmed dengue samples. So they are confirmed dengue from patient, and then tested on 5 different COVID-19 RDTs. And the samples, the panel of the evaluation panel consists of all 4 serotypes, 15 samples each, and 20 and 10 for the dengue 1, 2, 3, 4. So they are quite representing all of the serotypes of the dengue. So remember, these are dengue samples from the patient that were collected between October 2018 and March 2019. So it's well before the COVID-19 first detected. So this is true negative, should be a true negative COVID, this one. So, and what about the results? So we tested this on RDTs, and here is the results. When tested on 60 dengue confirmed samples, the 5 RDT brands for COVID, overall the brand shows high specificity on dengue confirmed samples. That's why, because only one of the samples with positive dengue IgG and IgM was positive for COVID-19 IgG. And the other sample is dengue 2 samples with IgM and positive for COVID-19 IgM. So these are the overall specificity data. These are the IgM, and the other one is IgG. So if you look at the percentage here, so like for these examples, it's 60 out of 60, 0 out of 60 are IgG positive. So the specificity is 100%, while this one is one of the dengue sample was positive on IgM, on COVID IgM RTT. And then the second experiment was to assess the possibility of cross-reaction of COVID-19 with dengue diagnosis. And this, we would like to know the specificity of RTT against COVID-19 IgG and IgM positive samples. So the dengue RTT tested using samples that are positive for COVID-19 IgG and IgM. So this one is COVID-19 IgG IgM positive samples tested using dengue RTT. So the check, this is also important to check whether the person or patient with COVID-19 IgG and IgM positive can also positive for dengue RTTs. So this one is the aim to check if you have a positive IgG and IgM, and then you come to you are tested with dengue IgG or IgM, whether your sample is positive as well. So the study set is in Jambi under the supervision of Dr. Sotaningsih Arianto. So we use 49 sera from person, asymptomatic sera. This is those people are healthy person basically, because they are coming to the hospital to be tested with IgG and IgM because they are traveling. So as I mentioned before, when Indonesian person traveling, then in some hospital, the requirement of the government is that you have to be tested using COVID-19 rapid test. So those are the positive person using COVID-19, but they are asymptomatic, so they are healthy, well, or yeah, asymptomatics. And the dengue RTT that was used to test was this one, SD biosensor, dengue duo, NS1, IgG and IgM combo. So this rapid test testing three components. NS1 is the antigen, the IgG and IgM for dengue. And then the one that was used to test those 49% was this one, the COVID-19 IgG and IgM. And this is the results. So for 33 persons with the COVID-19 positive IgG, when tested on dengue RTT, 2 of them are positive. And then for 19 positive IgG, when tested on dengue IgG, 4 of them are positive. So this shows that there are the possibility of false positive on dengue, the possibility of cross-reaction. So this is the second result. And the third result is using the confirmed samples. So COVID-19 RT-PCR positive patient. So they are COVID-19 patients tested with dengue RTT. So this is again to assess the possibility of cross-reaction between the COVID-19 with dengue diagnosis. And this is to evaluate the specificity of RTT against COVID-19 PCR positive samples, whether the RTT is quite specific for dengue. And then to check whether the patient positive for COVID-19 can also be positive when tested using dengue RTTs. The study set was in Bali, Denpasar, under supervision of Dr. Sri Masyeni. And we tested sera from 96 patients, tested positive for COVID-19 RT-PCR, and tested using one of the dengue RTTs. So the PCR was using this PCR kit, ASAR Fortitude and Life River RT-PCR. And then the dengue RTT that was used is the dengue duo SD biosensor dengue duo NS1 IgG, IgM, and IgM combo. So, and this is the results. So among 96 COVID-19 patients, when tested on dengue RTTs, 1 patient positive for dengue IgM, another patient positive for dengue IgG, but another patient got positive for 3 of them. So this is suggesting that there is a co-infection of dengue and COVID-19 in Bali. So this is the result of the results, and I think this is another findings. This is a different set of patient. So in Bali, my colleagues, Dr. Sri Masyani, also found few cases of possible cross-reaction of dengue and COVID-19. So this one is for the first case is a dengue wrongly diagnosed as COVID-19. So this one is the case one is the patient. And if you look at the clinical characteristics, myalgia, headache, arthralgia, this is a characteristic of dengue, like this one here, and also blah 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 blah, and normal X-ray. But when tested using the COVID-19 IgM and IgG, they are positive, and also NS1 positive. And the second one is the similar one, suddenly and continuous, and it's positive for both here. And when it was PCR, then we confirm it is a dengue. But the first one is showing that there is a possibility to have, well, I don't know whether it is false positive or a real cross-reaction. And the third one is the possible dengue and COVID co-infection. This one is, if you look at this one here, the myalgia is still there, and then a fever, and then it's not headache. Later, before the Prof. David saying about it, the headache is not really prominent in COVID-19, but they are arthralgia here, nausea. It's kind of most of the symptom of dengue is there, and yeah. But so this is the interesting one, is that the dengue NS1 rapid test is positive. So dengue NS1 is the confirmatory diagnosis for dengue according to WHO, and again, the PCR swab from the nasopharyngeal swab is also positive for dengue, for COVID-19. So this suggests the possibility of dengue co-infection in one of the patients in Bali. So in conclusion, I think we agree that there are similarities between both diseases in dengue and COVID-19, both in clinical and laboratory features. And when we evaluate the performance of COVID-19, 5 different COVID-19 antibody RTTs, again, dengue samples, the specificity is generally quite high. So yes, for dengue, so be informed that this is specific for dengue. We don't evaluate the specificity again for other viral diseases like influenza, hepatitis, or other fever or other febrile illnesses like a chikungunya or malaria. So the specificity here is specific for dengue. And we provide evidence of cross-reactivity or false positivity between dengue and SARS-CoV-2, which can lead to a false positive on dengue serology. And we observe a possibility of dengue and SARS-CoV-2 infection in Bali. So remember that NS1, dengue NS1 and RT-PCR for COVID were both positive. So given this, so I think healthcare workers should be aware of the possibility of co-infection and its dangerous impact on the patient mortality rates if there are co-infection, especially in the coming months in Indonesia, where there will be lots of dengue patient given the wet season at the end of the years. And then I think simple and good rapid test that is capable of differentiating dengue and SARS-CoV-2 with its sensitivity will be very useful. And again, the last one is that our study highlight the importance of recognizing false positive dengue serology result in patients with COVID-19 and vice versa.